Also for this one, I'm sorry. It's going to be one or the other. I don't know which one they're going to go with.
Okay.
It'll be one or the other. My guess is the newer filed amendment. But we'll see
And
what he
who's
says.
carrying it? Good morning. This is March 19, 2024. The time is 10:37. The Insurance Committee of the Tennessee House of Representatives is now in session. Madam Clerk, please call the roll.
Representatives Sapicki, Davis, Freeman, Helton Haynes, Hemmer, Hicks of Hawkins, Hill, Johnson of Montgomery, Johnson of Knox, Lafferty, Mitchell, Ritchie, Rudd, Rudder, Sparks, Terry, Thompson, Vice Chairman Martin of Carroll, Chairman Kumar. Mr.
Here.
Chairman, you have a quorum.
Thank you. Members, do we have any personal orders? Chairman Martin, you recognize.
Thank you, Mr. Chairman. I'd like to recognize some of the finest EMS folks from all over West Tennessee. A lot of them are my constituents, but they are representing majority of West Tennessee here on the front row. So help me welcome these guys for their day on the Hill.
Any other personal orders, members? Seeing none, we will proceed with our agenda. Our first bill is House Bill 2921. We have a motion and a second. Chairman Williams, you're recognized on House Bill 2921. We have a couple of amendments. Kindly tell us which ones we need to attach.
The First Amendment is rewrites the bill because it started as a caption bill, drafting code 15521.
Okay.
And I would like to also adopt the other amendment as it clarifies other sections of code.
One at a time? Okay. So, thank you. We have a motion and to adopt and a second on Amendment 15521. I'm told we're supposed to do it one at a time. So without objection, we are voting on attaching Amendment 015521 to House Bill 2921. All those in favor, please say aye. Opposed? The amendment goes on. Chairman Williams, you're recognized. Do you need to say something on the amendment?
Yes, Chairman. Your fantastic legal staff reminded me that the new amendment, which was the second one, so is the one that we want because it actually did rewrite the first drafting language. So unfortunately, we'd have to rescind our actions on the previous amendment and ask the committee to pull up the previous.
Yes, Chairman speaking.
Can't we just adopt amendment with replace what we just put on?
Okay. So upon legal advice, we are told that if we adopt the second amendment, it will superimpose the first one and delete that.
Yes, thank you, Chairman.
All hearts and minds clear about it? Okay. So we need I think I have a motion on amendments 016205 and we have a second. Without objection, we are voting to adopt 016215 to House Bill 291. All those in favor, please say aye. Aye. Opposed? The amendment goes on the bill. Chairman Williams, you're recognized on the amended House Bill 2921.
Thank you, Chairman and members. My apologies. It's very unusual for me to stand first in a committee to present a bill, particularly since Chair Lady Hazelwood is the second one on the list. So I'm a little bit nervous there. But this bill is a simple bill brought to you by the Speaker of the House. What this would do, it would require parity for mental health reimbursements for all of Tennesseans on TennCare and make it consistent with what we currently pay for mental health and substance abuse treatment. For far too long, our mental health providers across the state have not been reimbursed at an equivalent rate to mental health and substance abuse treatment. This would remedy that. I recognize it does have a fiscal note, but I hope to work with my colleagues to try to help and the Speaker to try to get this funded. I'm happy to answer any questions the members might have.
Members, you've heard the explanation. Do you have any questions? Questions been called without objection. We are voting on House Bill 2921 as amended. All those in favor, please say aye. Aye. Opposed? The bill goes on to Finance, Ways and Means.
Thank you,
And
Chairman and members.
good luck with the fiscal note. Item 2. Let me handle some housekeeping. Representative Hill, you're recognized.
Thank you, Mr. Chairman. I know I'm out of order, and I apologize. I missed the opportunity for personal orders. Joining us in the audience today, I have my youngest son, Mr. Hudson Hill, and I think he may have stepped out here real quickly, but I just wanted to welcome him and ask the committee members to make him welcome as well. So thank you.
Well, we'll wait for him to come back. Thank you. No, these are important things. When our children come, they are so proud of us, and we are proud of them. Item 2, House Bill 2322 by Chair Lady Hazelwood. We have a motion and a second, and you're recognized on this bill. We see an amendment. I have 0145152.
That's what I have. Thank you.
Okay. Can I have a motion and a second on the amendment? Thank you. So we are, without objection, we are voting on attaching amendment 0145152 to House Bill 2322. All those in favor, please say aye. Opposed? The amendment goes on the bill. Chair Lady Hazelwood, you're recognized on the amended House Bill 2322.
On the amendment or the bill as amended.
As amended.
The amendment just made clear that these provisions apply to hospitals in the state. But what this bill is attempting to do is to make sure that insurance companies can no longer just arbitrarily limit the number of days that are covered for post-acute care for brain injury patients. These would be patients who had an automobile accident, a motorcycle accident, stroke, or other types of brain injury. Now, insurance companies can limit the amount of time that they're in rehab, regardless of if the doctor and the facility feel that additional days would provide additional recovery and a better quality of life long term. There's similar legislation that was passed a year or two ago in Texas that deals with the same thing. And this would only apply to hospitals that are accredited for this type of work. There's one Chairman Helton and I have in our community, Siskin Rehab Hospital. And it doesn't apply to a lot of patients because these injuries don't happen that often that, they're out, the recovery time is outside, I guess, what the insurance company would determine. But for those who do, whether that's, 20 patients a year or whatever, the difference is lifelong. For the rest of their life, they are limited by that lack of recovery. So this would simply say if the doctors who are responsible for the recovery feel that a few more days is going to make a difference in long-term recovery and long-term quality of life, that the insurance company can arbitrarily deny that. So with that, I would ask for your support.
Members, you've heard the explanation. Any questions? Seeing none, I thank you for bringing this. These are devastating injuries and they need lifelong support. And I think there are times in life that, yes, it's costly, but again, to sustain and support human life, that has to be done.
Well, actually, this kind of recovery, additional rehab time can limit the amount of money and funds downstream that would be, needed for somebody if their recovery is more complete. So it does have a fiscal note. So I'll hopefully talk to somebody in finance and see if we can work that out. But it will go behind the budget, I'm sure, with lots of other good bills. But we will do our best.
Sure. Well, good luck to you. Thank you. Members, we are voting on House Bill 2322. All those in favor, please say aye. Opposed? The bill goes on to Finance, Ways and Means.
Thank you very much. Thank you, committee.
you. Item 3, House Bill 2010 is rolled 1 week. Item 4, House Bill 2212, Chairman Haston, you're recognized. We have a motion and a second.
Thank you, Mr. Chairman. The reimbursement rates for rural hospitals have been stagnant since 2006. This lack of adjustment has led to rural hospitals dealing with rates that do not reflect the inflation rates that we've seen in the last 17 years. This bill aligns outdated TennCare reimbursement rates with the official break-even rates recognized by the U.S. Department of Health and Human Services for inpatient services for rural hospitals. With that, I'll be glad to answer any questions.
Thank you for the explanation. Members, do we have any questions? I think we are all in support of rural hospitals.
And I will, if I will just add.
Sure.
I know I see some friendly faces from finance on here. I know this has a fiscal note of $215,000, but I would keep in mind that with each job at a rural hospital, it reflects a plus minus of 16 jobs locally. So we have 14 hospitals that this would affect. That comes to the tune of about 400 positions, or 400 positions. That's about 6,000 jobs locally that could be created or lost. So just keep that in mind if we do get out of here and move on to finance.
Well, that's good practice for your presentation to the finance. Members, any further questions or thoughts? Seeing none, questions been called. We are voting on House Bill 2211. All those in favor, please say aye. Opposed? The bill goes on, guess what? Finance, Ways and Means.
Thank you, Mr. Chairman, committee.
Thank you. Item 5 is House Bill 2557. It is off notice. Item 6, House Bill 2954 by Representative Hardaway. We don't see him. We'll roll it to the hill of the calendar. Item 7, House Bill 2039. Is rolled 1 week. Item 8, House Bill 1988. Mr. Speaker Johnson, you're recognized. We have a motion and a second.
Thank you, Mr. Chairman. House Bill 1988 renews the nursing home bed assessment through June 30th of 2025.
Thank you. Members, we do it on an annual basis, and it's an important bill. Do you have any questions?
Question on the bill.
Questions been called. Without objection, we are voting on House Bill 1988. All those in favor, please say aye. Opposed? The ayes prevail. Bill goes on to Finance, Ways and Means. Thank you. Item 9, House Bill 2374 is also rolled by 1 week. Item 10, House Bill 1074, Chairman Spicky, you're recognized. We have a motion and a second, and we have an amendment.
That is correct, Mr. Chairman, 014423.
Yes, that we have a motion and a second on this amendment. All those in favor of attaching this amendment to House Bill 1074, please say aye.
Aye.
Opposed? The amendment goes on the bill. Chairman Spicky, you can explain the amended bill to us.
Thank you, Mr. Chairman. This prohibits a health insurance entity from discriminating between a chiropractic physician and a medical physician with respect to the methodology used to calculate reimbursement or the amount of reimbursement to be paid for a service that is in the lawful scope of practice of a duly licensed chiropractic physician. It prohibits a health insurance entity from attempting to circumvent such prohibition by creating a chiropractic specific code or payment methodology not listed in the nationally recognized code book used by the health insurance entity for determining the amount of the reimbursement. That's what the bill does, Mr. Chairman.
Thank you, members. We've heard the explanation. Any questions? I guess many of us have seen the chiropractors. Without objection, we are voting on House Bill 1074. All those in favor, please say aye. Opposed? the ayes prevail. For a no, kindly see the clerk and record it for the purpose. Thank you, Chairman Spicky. Oh, this bill goes to Finance, Ways and Means. The last item, 11, is House Bill 0416 by Representative Hammer. We have a motion and a second. Representative Hammer, you are recognized.
Is around expanding PACE. This legislation would expand the PACE program here in Tennessee. PACE is a national model for managed care and currently has a very successful location in Hamilton County. You'll likely remember the PACE Association came and presented to us earlier this year. What PACE is a coordinated health and social services program that enables participants to remain in their own homes and communities rather than moving to nursing homes if not needed. It's a unique system of managed care that treats members at the PACE Center, which is a one-stop shop, takes care of their clinical, social, and behavioral needs. As amended, this bill caps the participant enrollee numbers each year to encourage smart growth of the program, expected to start with 1,000 enrollees in fiscal year 2026 and go up to 3,000 in fiscal year 2030. With that, happy to answer any questions.
Thank you. We forgot some housekeeping. There is an amendment we need to attach, and I think you've described the amended bill. I have 015581. We have motion and second to adopt the amendment. All those in favor, please say aye. Opposed? So amendment 015581 is attached to House Bill 0416, and Representative Hammer has described the amended bill to us. Any questions? Questions been called. All those in favor of House Bill 0416 as amended, please say aye. Opposed? The ayes prevail. The bill goes on to Finance, Ways and Means.
Thank you, members of the committee.
Thank you. We will go back to the bill we rolled to the hill. Representative Hardick, can you run up to the podium? Members, that was item 6. And Representative Hardway has made it to the spot. So we have a motion and a second. You're recognized on House Bill 29454. I also see an amendment.
Give me just a minute, Mr. Chair.
Before they started getting the bills to 15, Hardaway used to have like 300, and he would arrive with no idea. So that was one of the things that Jerry, Speaker.
Thank you, Chairman. And Amendment 15851, I would like that on, and then
We have a motion and second to attach amendment 015851 to House Bill 2954. All those in favor, please say aye. Opposed? The amendment goes on the bill. Representative Hardway, you can explain the amended bill to us now.
thank you, sir. And the amendment came from F&A, and I appreciate them working with me on this. This bill very simply is to save lives, space, simply saying that the ability to access some of the new technology to determine when the onset or signs of the illness, prostate cancer, first occur, and to save lives. We know that the earlier that you're able to detect the disease, the more likely you are to save lives. And I'll just leave it right there.
Thank you. Members, do we have any questions? Seeing none, we are in an agreeable mood today. We are voting on House Bill 2954. All those in favor, please say aye. Opposed? The ayes prevail. The bill goes on to Finance, Ways and Means. Thank you.
Thank you, Mr. Chairman, and thank you to the committee members. We're literally going to save thousands of lives with this, just by early detection. Thank you.
You. Member, any other business before the committee? Seeing none, we stand adjourned. Okay.